Hi, this is Dr. Jeff Hodrick from Southern Joint Replacement Institute in Nashville, Tennessee. I'm talking a little bit more about minimally invasive surgery. We started this conversation clarifying what minimally invasive means. So when we talk about joint replacement, I personally believe it has less to do with the size of the incision and really has everything to do with the soft tissues underneath, the muscles, the tendons, the ligaments, how we treat the tissue during the operation that makes a big difference. One of the things that's hard to appreciate, and everyone's different, is how much inflammation is created with surgery. Now, I'm very fortunate to have a job where we get rid of pain causing arthritis. So when we do a joint replacement, we take all the arthritis out. So when a patient comes out of the operating room, believe it or not, all their arthritis pain is gone. Now what they're left with during recovery is the soreness from doing that surgery. And that's cutting through muscle, cutting through tendon, releasing ligaments. I do direct anterior hip replacement, which is considered a minimally invasive technique. Now I think it's minimally invasive in how much we have to maneuver or manipulate the soft tissues underneath. So traditionally hip replacements were done through the back of the hip. Now when we did that, or we do that, you have to cut through the gluteus maximus, which is the largest muscle in the body. Now that can be pretty thick and pretty big. That leaves you with a lot of inflammation. The other thing, in order to get through the back of the hip capsule or into the hip joint, you have to detach tendons from the back of the hip, and at the end of the procedure, then reattach those tendons. That's also a source of inflammation, I think, and discomfort after the procedure. In a direct anterior hip replacement, we're just traveling through the front of the hip. Believe it or not, your hip joint is closer to the front of your body than to the back of your body because of the thickness of your gluteus maximus. So when we go through the skin, it really sometimes is only an inch or two before we get to the hip capsule and the hip joint, and we're only spreading muscles apart. So we don't have to cut through any muscle tissue during this procedure. It allows that patient to have less inflammation after the surgery. It's not something that you can measure, but I can tell you that my patients recover a lot faster. This is the most common procedure I perform on an outpatient basis. And what that means, a patient would have surgery, let's say at first case, 7:30 in the morning, and usually are leaving the surgery center or the hospital by noon, which is a huge leap if you think 15, 20 years ago when someone having a hip replacement or a knee replacement being in the hospital for 3, 5, or even 7 days. Now, the advantages of that are many. Number one, less pain medicine after surgery, faster recovery, of course, back to work a lot quicker as well, and less discomfort. I think that's one of the biggest fear of patients after surgery is how much discomfort, how much pain am I gonna have? All these techniques that we're talking about that I think are minimally invasive make a huge difference for patients in recovery.